Good morning. Let's see about musculoskeletal system. In this first condition, we will see the fracture. In a fracture, we can see the signs and symptoms. The patient will have a part of a body, whichever is fractured, pain, swelling, deformity, muscle spasm, cool extremity, and neurovascular status. In neurovascular status, we can see there is a loss of functionality, coldness, and the patient will be having no blood circulations and no stimulus due to the nerve injury. All this can be seen in the signs and symptoms of fracture. Emergency management, we use RICE, that is rest, ice application, compression and elevation. Traction, we will apply for the patients, depends upon the fracture type. Temperature of the extremities, we will be assessing. Ropes need to hang freely. Alignment, we need to monitor. Circulation to be checked. Types of fracture to be checked. Increased fluid intake. Overhead trapeze, no weight on the bed or the floor to be kept. Cast application. Once the cast is applied, we need to check for the 5 P's and we need to check the circulation of the patient. The circulation, compression and the pain is different. If the patient is having pain, we will go for a patient pain medications. But if there is a circulation is been getting affected, we will report to the doctor and we will change the cast immediately. So we need to check pain, spot, redness, warmth, everything. Elevation of the limb, 5 P's, we need to check pain, pallor, pulse, paresthesia and paralysis of the part of the body. Dry hot spots and foul smell to be noticed. Or if open reduction incision fixation, we need to check for bleeding, infection, paralysis. Example, the patient underwent any surgery and we find out there is a red spot in the part of the body. What we need to do, we just need to mark out so that we can observe whether it is bleeding excessive or it is not a bleeding, only a spot post-operative to the patient. Complication, pulmonary embolism, restlessness, chest pain and dyspnea will be common. Fat embolism, petechial rashes will be noted. Osteomyelitis, WBC will be elevated. Compartment syndrome, 5 P's, 4 to 6 hours we need to check and we will be noticing the unrevealed pain in this condition. Hip fracture. When we see the hip fracture, the first thing what we can identify in the hip fracture is whichever part of the hip. Example, the left hip is injured or fractured, then we can see the left leg is shorter than the right leg. This is the first signs we can identify in a hip fracture. Nervovascular system will be affected. Amount of drainage, abduction pillows, extended and elevated, DVT, avoid cross leg or bending over. Arthritis, osteoarthritis, rheumatoid arthritis. Osteoarthritis, the pain will be after exercise, hardness and Borchards. Evening stiffness will be noted. Rheumatoid arthritis, the patient will be having early morning pain, autoimmune disorder and the patient will be having even anemia. Management, range of motion exercise, correcting assistive devices, avoiding weight bearing, balance between rest and activity and pain management. Osteoporosis, primary reason, hormonal imbalance, low calcium intake, menopause. Secondary or oral contraceptives, hypothyroidism and Cushing syndrome. Signs and symptoms, back pain while bending, height, hand, spinal deformities. Treatment, increased calcium, calcitonin, estrogen, progesterone, hormonal management. And preventing injury, correct assistive device, move gently, avoid bending, contact sports. GOAT. This is an uric acid elevation, crystal development in the joints. The person will have redness and swelling in the joints. Management, purine-rich diet to be avoided. Avoid stimulants, beverages, alcohol. Treatment, allopurinol. Nursing management, we will give adequate fluids and diet management. Intravertebral disc prolapse. In this, cervical disc will be prolapse with upper extremity pain due to lumbar herniation. Signs and symptoms, lag radiating pain, sciatic nerve, surgical management, laminectomy or spinal effusions. Nursing management, dorso-recurrent position, avoiding lightweight and corrective, posture avoiding bending, weight control and alignment. Medical management, methylprednisolone to be reduce the cord prolapse. Amputation. Amputation will be done when the patient limb is being injured and there is affecting part to the rest of a body or life threatening condition, there we will go for amputation, or we will go for a patient with a diabetic foot or sepsis, all these conditions. Amputations, the post amputation, the patient will have bleeding, phantom sensation, contracture, infection. Phantom sensation, after removing the part of a body, the part of a extremity, the patient still feel they have the extremity, that is an phantom sensation. Postoperatively, we need to elevate the limb of the patient to the heart level for a proper blood circulation. We need to do the dressing according to the doctor's orders. We need to check the sensation every 48 to 72 hours, early mobilization, and evaluating with the residual pillows and massage. Any doubts, please contact. Thank you.